Hello, my name is Maia Nofal. I'm a surgery resident at Boston Medical Center and a Fogarty Fellow with the Stanford Department of Global Engagement, living in Ethiopia and working with LifeBox. I will be presenting an abstract called The Impact of Adapting a Surgical Safety Checklist Training to a Virtual Platform in Ethiopia. The Surgical Safety Checklist has been shown to reduce morbidity and mortality from surgery, though uptake in low-income countries is challenging. The Surgical Safety Checklist has been successful in implementation through in-person trainings as part of a quality improvement program in Ethiopia, with a 50% increase in correct checklist use. During the coronavirus pandemic, surgical safety checklist workshops were adapted to a virtual platform. We aim to evaluate the impact of these virtual surgical safety checklist workshops. From January to September 2022, 9 Ethiopian hospitals participated in a quality improvement program and received virtual surgical safety checklist training. Checklist utilization before and after was measured through direct observation of behaviors in the operating room. Using statistical process control methodology, we performed a time series analysis using population average generalized estimating Poisson regression. We calculated incidence rate ratios of correct checklist use pre and post intervention and predicted the change in average monthly compliance before and after the training. We observed and captured checklist compliance from 9,408 operations. 5,700 of those were prior to the intervention, and 3,708 were post-intervention. Our average monthly checklist compliance improved from 66% pre-intervention to 74% post-intervention. Statistically significant improvements were noted in all 9 hospitals. Virtual surgical safety checklist workshops improved checklist use and compliance, but to a lesser degree than prior in-person iterations. Virtual training can improve access to LMIC clinicians that are often far from educational hubs and allow training programs to scale where travel is expensive or inefficient. A better understanding of how to best adapt training to virtual platforms is needed.